Hello everyone, I am Dr. Amit Kulkarni. I am Senior Consultant and Lead Neurology and Stroke at Sakra World Hospital. Today I am going to talk to you about two basic types of strokes. One is an ischemic stroke and the other is hemorrhagic stroke. So when we talk about ischemic stroke, we are talking about an interruption of blood supply to a particular part of the brain. For example, there is an artery called as an MCA, and that artery supplies to the most of the part of the brain, and if that artery gets blocked either because of something sitting there and blocking it or because of a clot which has come from somewhere and blocking it, that leads to a decreased blood supply to that particular area of the brain. And whenever it is blocked completely, that area of the brain becomes slowly irreversibly dead. This is what happens whenever an artery starts blocking. However, there are people who can have collaterals in time and they can develop cross channels which can bring the blood supply to the brain. So one type of stroke is there can be a blockage because of the clot, and that can lead to decreased blood supply, and that can lead to neurological symptoms. There can also be a situation where there can be a rupture of the blood vessel. That's a blood vessel which tears or breaks, and that leads to leakage of blood vessels. It can either be in the subarachnoid space where we call it subarachnoid hemorrhage. It can be in the outside space where we call it as extradural hemorrhage. It can be in the subdural space where we call as subdural hemorrhage. And it can happen internally in the brain where we call as intracerebral hemorrhage. So there are various reasons for the various types of strokes. I think we can discuss them subsequently in other videos. Thank you.